What is the best exercise to do if you have back pain? By a Wellington Chiropractor. What is back pain? Standard low back pain is physically caused by one of three things. 1. Lack of support to some body part. 2. Lack or stability, strength, in some body part. 3. Excessive tension in some body part. What this essentially means is that when you get stubborn low back pain, it is being caused by some underlying mechanical issue that needs addressing. All pains are in some way the body's way of telling you that it is not getting something that it needs. Where do chiropractors fit in? So here's the thing. If you need root canal, there is no use thinking you are going to floss your way out of it. There is often also no point in thinking you can personally exercise your way out of a stubborn low back pain. This is where chiropractors and osteopaths come in. We provide the health care that paves the way for rehabilitation. Sometimes it is the chiropractor's job to break up scar tissue, sometimes it is our job just to release from muscle, fascia and joints. In all cases though, this is designed to move you towards a point where you are able to exercise and strengthen yourself again. Which exercises are best for my back pain? Basically, I advise my chiropractic patients not to try and use exercises for pain relief unless they know for sure that they have already figured out a reliable way of doing so. Instead, you should plan to stay active. The research data shows very clearly that people who keep active through back pain get better long-term outcomes than those who avoid pain and don't move. The research also shows that majority of people who try core exercises while they have back pain get worse as a result, because in my view they aren't ready for those exercises. A great plan if you have back pain and want to exercise is to think in terms of keeping mobile, promoting flow and movement, and avoiding any exercises that involve strain, especially in the trunk. General forms of exercises are great, like swimming, cycling and walking, and gentle stretching is all good too. What's the best exercise to stop my back pain happening? Okay, so now we are getting down to nitty-gritty. The textbook scenario that we are on the final page of is one where we limit trunk strengthening and actively work on our pain. Then once the pain is under control, we start true blue core exercises. Now that the tissues in the lower back are no longer acutely inflamed and the blood is flowing again, we can start strength work. The right core exercises are another long story altogether. I can definitely tell you that sit-ups and planking are 1000% absolutely, certainly, definitely, positively not for you if you have a history of back pain. Learning to isolate and strengthen the core is not something that can be done quickly or casually. To put this in perspective, I usually do around 10 to 20 one-on-one coaching sessions with chronic back pain sufferers before they can consistently and consciously activate their core. Conclusion: whether you are a chiropractor person, an osteopath person, or you prefer doctors and physios, really makes no difference to your reality of what your back needs. Isolating and strengthening your core is the ultimate endgame if you want a life free of back pain. Freedom is what this all really comes down to in my view. Being pain-free is about us having the ability to perform all the activities that we need in order to stay alive. Perhaps more importantly, being pain-free is about having the freedom not only to stand, sit and walk comfortably, but to lead a life that feels good. I'd love to help you achieve this. Give us a call today at the Featherstone Pain Clinic in Wellington CBD on 04385 6446.